Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could tune in today. Our guest is Eliz Green. She's a motivational speaker, and she's joining us here today to share her very personal story about surviving a heart attack while pregnant with twins. She's also going to talk about her passion and her involvement with a brand new initiative called Take Cholesterol to Heart. Welcome to Health Professional Radio. Eliz Green, how are you?
I am fantastic. Thank you so much for inviting me.
Thanks for joining us today. Now, I said you're a motivational speaker. That's quite a busy lifestyle. Give us a bit of background about yourself.
Well, as you mentioned, I'm a heart attack survivor. When I was 35 years old and 7 months pregnant with twins, I suffered a massive heart attack. And luckily, I was in the hospital already on bed rest, so I got great care right away, which is why I'm still here, and my girls are just about to turn 17.
Mm-hmm. Let's talk about some of the risk factors. I mean, you're very young, you're healthy, you're pregnant with twins, life is just going great, and you have not a heart attack, but a massive heart attack. And a lot of people don't come back from that. Many people don't.
Well, my heart attack was actually caused by my pregnancy. Because we're speaking to health care professionals, I know there'll be questions, so I'm going to try to do this as specific as I can. So technically, I did not have a heart attack. I had a spontaneous dissection of my LAD. What they believed happened was because of the hormones in my body with the pregnancy and the volume of blood that my heart was pumping for me and the babies, the inside layer of my cardiac artery peeled away from the outside and fell across that opening like a trapdoor. And that's what caused my heart to stop.
Okay, so it wasn't necessarily the normal risk factors of high cholesterol that we are normally familiar with. It was something above and beyond that.
Correct. Now, having had that experience, if I want to be here and get to see my girls graduate from high school and go to college and get married and all those things that I really would like to experience with my family, I need to do the work to make sure that I'm controlling every risk factor I possibly can. And that is why that's really what set me on this mission. I woke up from surgery knowing that I'd been giving this wacky story for a reason. And I've been traveling the country, as you said, getting people to pay attention to their heart health and manage their risk factors for nearly 2 decades now, which is why I'm so delighted to be part of this campaign and partnered with Kowa Pharmaceuticals America for the Take Cholesterol to Heart campaign.
Well, let's talk about this campaign as a passionate health advocate. What is your role as far as bringing awareness, other than what you've been doing for a couple of decades, as you've been saying? Some of these risk factors are very, very hard to avoid.
True, and we can't outrun our own family history and our age and our ethnicity and that sort of thing. We can't change some of those things, but we can control the ones that are possible. And certainly cholesterol is one of them. They're great medications that can lower our cholesterol and really protect our hearts. But my role is really from the patient side, in that when patients experience side effects or difficulty taking a medication, we aren't very likely to bring that up with our doctors, or we're a little shy, or we don't know how to do it. And we certainly don't want to be seen as a complainer. And sometimes we're less than good about following our doctor's
absolutely.
instructions and may not share that information. But I know from my own experience that the only way to really get the treatment that's best for me is to have open communication with my doctor. And even though I may be a little embarrassed at the fact that maybe I didn't follow directions just exactly as my doctor told me to do it, if I go in and I explain what's going on and I really have a conversation about how it's impacting my life as opposed to just saying, oh, well, this is kind of annoying, then we can find a solution.
Is this relationship that you have with your healthcare provider now, is it a direct result of your experience having this heart attack and the situation that you were in? Or was it something that you saw a need to evolve regardless of your health situation? How did you personally cross over to where you had this give and take relationship with your provider in order to better your healthcare outcome?
Well, I will say the cardiologist who saved my life is an amazingly wonderful, warm, compassionate person. And we had, even though I met him in the cardiac cath lab while I was intubated, we still had great rapport. He's a father of twins. He really looked me in the eye, even though I couldn't respond to him, and talked to me in a way that made me feel like I was participating, even though really he didn't have to talk to me. So he came literally to the table with a great bedside manner. That has not been my experience with every doctor I've encountered along the way. And particularly, I was 35 when this happened, and it was 17 years ago. So a younger woman with heart issues was not something people were used to seeing. Absolutely. And there was a lot of dismissing of my concerns until sometimes I have to get a little strident and like, no, you need to actually answer my question. How is this going to interact with my medication? Can I take this with my history of heart attack? And so I had to be my own advocate. I had to partner in those decisions to make sure that I was getting what was the best treatment for me.
Take a little responsibility for your own health care.
Absolutely. And that's really the goal of the campaign, is to empower patients to partner with their doctors to get the best possible treatment.
In your experience, and as you have heard from others who are involved in this initiative with you, or folks who are taking advantage of the information that this initiative affords them, what type of feedback do you get from doctors when they experience this newfound empowerment?
The only way, I often say that a stethoscope is not a mind-reading device. The only way a doctor can really know what's going on with a patient is if the patient tells them. So on the TakeCholesterolToHeart.com website, there is a quiz that patients can go through and really kind of document their experience with the statin they're taking, be able to print out the profile that they get as a result, and take that to the doctor that provides really kind of a script to have that conversation. And you know, doctor's appointments are getting shorter and shorter. So when a patient walks in with a piece of paper in the hand, that's a pretty good signal. There's a conversation that needs to be had. So on both sides, I think when there's the signal that something needs to be discussed and the patient comes in and doesn't get off on the tangent, which we all know, the time for that appointment can go by in a flash.
Absolutely.
If you get off on the wrong subject. But we're going to stay on the subject because we have it right here on a piece of paper. That's key to finding the right treatment.
Now, in wrapping up, Eliz, talk about the frustration that sometimes you experience in this journey in trying to get awareness out there about cholesterol when there are so many of us that are affected by it.
So I think one of the challenges is that you can't look at somebody and say, oh, well, they have high cholesterol. And you can't look at yourself in the mirror. There's only one way to find out. You have to go in and have a blood test. So one of the things I hear from audience members all the time is, well, I don't want to go to the doctor because they're going to tell me there's something wrong, which is completely backwards to how we should be behaving. So we have to get over that hurdle. And the more we talk about cholesterol, it's like women and heart disease. When I started in this, it was really just even educating people that women had heart attacks. We've come a long way. We have still some work to do, and we have some work to do in educating people about cholesterol, but the best thing we can do is just keep talking about it.
Where can we go online as listeners and get some more information about this initiative?
The best place is to go to TakeCholesterolToHeart.com.
TakeCholesterolToHeart.com. Just like it sounds?
Just like it sounds, and it's a word to T-O as opposed to a number.
Thank you so much for coming in, Eliz Green, motivational speaker and health advocate. I'm hoping you'll come back in some future segments. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au. and also at hpr.fm. Subscribe to the podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page when you visit us at healthprofessionalradio.com.au and also at hpr.fm.